Happening now, President Donald Trump waiting for House Republicans to approve what he calls the big, beautiful bill. There's some live pictures right now from the White House today. The president meeting hardline conservatives and moderate Republicans at the White House, trying to get them on board with that bill. Now, this all in an effort to win support for that massive spending and tax bill.
Now, the issue now, some lawmakers say they don't agree with the changes made in the Senate, something supporters say they're not concerned about.
There's some that still are holding out for something different, but at the end of the day, they know this is probably as good as we're going to get.
Every Democrat in the House opposes the bill, which means Republicans can only afford to lose 3 votes if all members are present.
And the passage of the tax spending bill, as it's written now, would have major implications on Medicaid. It would pull around $1 trillion from Medicaid funding and disqualify nearly 12 million Americans from coverage.
That's according to research from the nonpartisan Congressional Budget Office. 10 TV's Carla Rogner learned how it could impact you.
We talked to people at a Medicaid office here in Franklin County who say there's been a lot of confusion over those discussions to cut Medicaid, and they're hopeful they wouldn't lose their coverage.
So if they take it away or make it harder to receive, then that's going to be a problem for a lot of people.
For Marcus Croft,
it would be very sad.
And Desiree Warren, it's a lot of confusion and I don't knows when it comes to their future health care.
My mom put me on it when I was younger, and it's kind of just been very helpful.
Warren relied on Medicaid to take care of her daughter as she battled cancer.
I probably wouldn't have been able to get her back and forth, to those doctor's appointments, make sure, she got the proper help that she needed. So it impacts us a lot.
The proposal includes new work requirements and reporting requirements for people on Medicaid. The White House maintains there are no cuts to the program, saying it protects and strengthens Medicaid for those who rely on it, while eliminating waste, fraud, and abuse. Meanwhile, the Ohio Healthcare Association is raising the alarm. The bill would also reduce the federal funding states like Ohio receive to reimburse certain healthcare facilities that treat people on Medicaid.
If they start making cuts at the state level because they don't have as much money coming from the federal level, then you're going to see services reduced. You're going to see providers potentially going out of business. It's a really challenging situation.
Van Runkel explains people would likely see reduced services at hospitals, skilled nursing facilities, behavioral health services, and facilities for people with disabilities.
So what's the concern with how these changes could impact healthcare?
Obviously, the ability to deliver good healthcare, good quality healthcare, and to serve the people who need to be served depends on the funding that's available.
With the future of Medicaid in limbo, families now start to imagine life without the care they've always counted on.
As far as the cuts, I think that's going to hurt a lot of people.
The changes to Medicaid included in the big, beautiful bill are not final, but President Trump has asked lawmakers to get the bill on his desk by Friday. Reporting in Columbus, Carla Rogner, 10 TV News.